My name is Robel Irgu. I'm a lecturer at Addis Ababa University School of Public Health. And this time I'm working for the CDT Africa based at Addis Ababa University College of Health Sciences as a PhD student working on scabies research project. The project is conducted to mainly measure the effect of a mass drug administration given for onchocerciasis to see the secondary effect on the transmission of scabies because the drugs that are given for the control of onchocerciasis in terms of MDA or as an MDA is similar to that of drugs used for scabies, but the prevalence of scabies doesn't seem to decrease despite the frequent administration of the MDA or the ivermectin MDA to reduce that of onchocerciasis. So we are interested to know why the drug fails to reduce the prevalence of scabies while it is a similar drug given for both cases. So this is going to be our major outcome. And there are additional research questions that we aspire to answer. For instance, what is the magnitude and geographic characteristics of scabies, especially in the scabies outbreak-prone northern part of Ethiopia? And also we will see what is fueling this frequent outbreak. So those are our major interest areas. Scabies is currently considered as a neglected tropical disease. It is caused by a mite called Sarcoptes scabivar hominis. And this mite burrows right under the skin to cause the infestation. And at first, the infestation causes this serious itch, especially during night times. It gives serious discomfort for the patient and also undermines quality of life. But it also has a long-lasting complications on the liver, on the kidney and that of heart diseases as well. Even though these complications happen to be found in a lesser frequency, especially in relation to the number of individuals infected by the mite at the beginning, yet these complications are serious and dire if they happen, and also the impact of scabies on the quality of life of individuals is serious even at the onset of the infection, even taking out the potential serious long-term complications. Well, scabies normally affects almost all population groups, beginning from children to the elderly, even though this pattern might differ in different geographic settings and in different parts of the world. For instance, in case of the developing world, it mainly affects children under the age of 5 years and also adolescents. When we come to the West, scabies tend to affect the elderly people who are being taken care of in elderly care home facilities. So, being this the case, our interest to study scabies originated from the history of unusually frequent outbreaks in Ethiopia, especially in the northern part of the country. And these days it is growing to be a national outbreak affecting all the 4 major regions, which are the Amhara region, the Oromia region, the southern nations, nationalities, and peoples region, and also even parts of the Tigray region. So the Ministry of Health is interested to know why this unusual outbreak patterns are taking place at this time of the year. As far as my understanding goes, originally at the inception of this project there was an interest from the Ministry of Health side, which is very important because it enhances the likelihood of the evidence that we generate to be utilized by the Ministry of Health in Ethiopia. And even after we have initiated the project, the Ministry of Health has shown a noteworthy participation in the process of data collection and also in helping us undertake those field works smoothly. And they have been frequently contacting us if there is any evidence that they may obtain from us concerning at least the epidemic pattern of scabies, because in Ethiopia we do not have much evidence on scabies and it is not a well-studied area. And at this point in time, the ministry is facing these serious patterns of scabies outbreak, and they they are in the process of developing a guideline to control scabies outbreaks, yet they don't have enough evidence to base their outbreak control guidelines on. So they are really interested to obtain any sort of data, any sort of information from the team. And I believe, especially the final outcomes, both in terms of the epidemiologic pattern and also that of the control efforts and also additional economic studies that are being undertaken by parts of our team, will collectively provide the required data for the ministry, and it will be substantial in helping out the ministry in order to strategize the right control strategy.